Hi, everybody. We're going to get started here in a minute. We're just going to wait a few seconds here to see if anybody else logs on for our Friday Facts. It is Better Speech and Hearing Month, and today we are going to be talking about just saying yes to mess, fun feeding ideas for play and exploration. So we'll just wait another minute here to see if anybody else joins us. All right, we are going to get started. Welcome to Tender Touch Therapy, a partner with Medical Support Services, and we are here with our Friday Fun Facts. And today we are talking about just saying yes to mess and talking about fun food exploration. So for those of you who probably don't know me, my name is Jennifer Marie Eggert, and I am a pediatric speech language pathologist with Tender Touch Therapy. I am a clinician who's had over 20 years of clinical experience in the field, working primarily with children with pediatric feeding and swallowing disorders, and also work primarily at Marquette University as an assistant clinical professor. So it is absolutely my pleasure to be a part of this team and get to share my expertise and work with our amazing staff. And am interested to hear from you. So certainly if you have comments, type them on the side. I'm more than happy to try to answer them as we go along or at the end and to open up the dialogue. So let's start by talking a little bit about some definitions. Let's just go with finding out what we need to know about feeding and sensory-based play, and then talking about what are some things that we can do in the home. So the first thing that I want to talk about is a wonderful organization that is called Feeding Matters. You can find it very easily on the website or on Google, Feeding Matters. And they have recently worked with a large team of experts in defining what is a pediatric feeding disorder. And so PFD, or pediatric feeding disorder, is a new diagnostic criteria that literally just came out within the last year. Very exciting to have this now, this information, and I want to review with you what the definition of this is. So a pediatric feeding disorder is impaired oral intake that is not age appropriate and is associated with medical, nutritional, feeding skill, and or psychosocial dysfunction. So if we think about that, and I'm going to hold up a visual here for everybody to see, we really see how we have all of these categories, and I bet that this is backwards too, but I'm still going to explain it. So we have our medical portion where, again, so maybe we have kids who have had prematurity or are being fed through G-tubes. We have kids who have nutritional differences or maybe nutritional disorders. We have children who have psychosocial components. They've always felt that feeding is scary and that feeding is not something that they enjoy. And then we have feeding skills. Because our kids haven't been able to practice, they don't have the skills to eat. And so all of this works together to make what we call a pediatric feeding disorder. Underlying all of this is sensory. And we're going to talk a lot about sensory and how we play today. I just want to remind you that feeding is a really intricate process, right? It is the single most complex and physically demanding task that we have to do. Which is really astonishing when you think about all the amazing things people do. People run races. I don't know why people run races. And people, are out there doing all of these amazing feats with their body. But just sitting and eating actually takes 26 muscles and 6 cranial nerves, which is absolutely phenomenal when you think about it. And if just one of those pieces is missing, that's where our kids start to fall apart. And they have difficulty even learning how to eat or drink. So some of the conservative evaluations estimate that about 2.3 million children under the age of 5 in the United States each year are diagnosed with pediatric feeding disorder. And so for each of these children or infants, even as they grow into young adulthood, um, every single bite of food can seem painful or scary or impossible to eat. And this impacts their nutrition, their development, their growth, and their overall well-being. As I said before, sensory components are a huge piece of all of this. So sensory processing disorder is probably something that most of you are familiar with, but if not, just to remind you, the definition of a sensory processing disorder is a condition in which the brain has trouble receiving and responding to information that comes in through the senses. And so we may see difficulty in being able to take in information through hearing, touch, or taste, and it can absolutely impact multiple senses. And remember that children can be over-responsive or under-responsive or a little bit of both. Eating is something that really takes a lot of our senses. It takes a lot of emotion too. Think about Thanksgiving. Thanksgiving is a great holiday. It's all about eating, right? And so there's the smell of the turkey in the oven. There's the sound of the football game on in the living room. There's the feel of the warmth of the kitchen or the hugs of your relatives. Of course, safely hugging when we don't have COVID, right? And thinking about all of those pieces that have to do with what is a holiday, what is the mealtime? And our kids don't get to experience mealtime routines. A lot of those sensory experiences are very negative for them. So there is a wonderful woman by the name of Dr. Kay Toomey, and Dr. Kay Toomey works for the feeding clinic at the Star Institute in Colorado. I was lucky enough to undergo her training and certification many, many years ago when she was here in Milwaukee. And she developed a program called SOS. SOS stands for Sequential Oral Sensory. So sequential oral sensory based feeding is a transdisciplinary program for assessing and treating children with feeding and weight or growth difficulties. And this program, which a lot of what we're going to talk about today is based off of, uses the principles and practices from multiple disciplines, including psychology. So again, we talked about all the emotions related to eating. Pediatrics, we aren't specialists in knowing what kids' weight or height or growth should be or their health should be, right? Dietetics, how much dietary intake should they take? How many calories should they be consuming? Speech language pathologists, occupational therapists, and physical therapists. And so this approach is very holistic in combining sensory, motor, oral, and behavioral learning, medical and nutritional factors and approaches in order to fully evaluate and manage kids with feeding and growth problems. So thinking about some of the information that we've learned from Dr. Kay Toomey, you can again Google this, or you can certainly email us, and we're happy to share this information with you. Again, for those of you who may not know me, my name is Jen Eggert. You can ask for me. She came up with this chart, which is called Steps to Eating. And as you can see, it is actually just that. It is a staircase. Now, what you may or may not be able to see on your end is saying that we have to be able to do all of these things in order to eat. Now, I know a lot of us have been sitting at home lately, right? And eating is something that's very instinctive to us. I think I'm a little too instinctive with eating. But we all just think we sit down, we eat the food. We don't even think about eating the food. But for our friends who have pediatric feeding disorder, they may not even be able to tolerate being in the same room as the food. They may not want to even interact with or look at the food. Think about foods that you don't like, foods that smell bad to you, okay? For me, personally, it's broccoli. I smell broccoli and I'm out. I don't want anything to do with broccoli. I've had some apparent bad broccoli experiences in my life, and at this point, I'm not sure I even want to try to get over them, but it's not impacting me. It's not impacting my weight at all. It's not impacting my growth. It's not impacting my development. But when our kids are so stuck in their foods and they only have a few different foods that they eat, or they don't even need enough food to sustain themselves, that's where we have difficulties getting stuck on these steps to eating, right? And they go into what we call food jags, where maybe they only eat one food. We know those kids who get stuck on macaroni and cheese for a week, or the chicken nugget kids, and that's the only meat they ever eat, right? So we have to think about how kids tolerate food, interact with food, smell food, touch food, and taste food before we even get to eating. There are significant number of steps involved in eating, and none of them have to do with just sitting down and putting the food in your mouth, right? So today's topic is just say yes to mess. And mess is really a very natural part of learning. I know that most of us as parents have pictures of our kids, or maybe for those of you who are joining us today, who maybe don't have kids that interacted with food or couldn't interact with food, how we either have or wish we had those pictures of kids with the food all over their hair and all over their face, or the spaghetti bowl that they dumped over on top of their head. That's how kids learn. They learn by getting messy. And we're going to talk a little bit about getting messy in a minute. There's a comic strip out there called Marvin. And if any of you are familiar with Marvin, Marvin is a comic strip character who is a little baby or toddler, and he gets into a lot of trouble. There's a very heart-wrenching comic that the writer-illustrator did one day, and it's simply 2 frames. It's a picture of him in his high chair playing with food and getting messy, and his mom is looking at him, and she's very angry. And the next frame is him turned sideways in his high chair in a corner in a timeout. And I saved that comic. Every time I look at that, it breaks my heart, because sometimes as parents, we forget that getting messy is important for learning. And we're more worried about table time routines or mealtime routines, or things that we should be doing appropriately in the restaurant with our family, instead of thinking about the idea that what kids are really doing is learning. So we need to think about, too, how we as adults handle and tolerate mess. What are our reactions to mess? If a kid gets messy, do we go, oh my gosh, what did you do? Or are we like, look at you, you got that pudding all over yourself. How does it taste? I bet it's yummy. Does it feel slimy? Oh, let's spread it around some more, and can you lick it off your fingers? Are we encouraging or are we discouraging? And we have to think about that. Same thing when kids refuse a food. If they take a food and they're like, kids make that face when they're trying to learn to eat food all the time, right? Do we go, oh, you don't like that, do you? Or do we go, oh, that's a new food. You're doing a good job. Chew, chew, chew. Yum, yum, yum. They feed off of our emotions. And so we have to be really careful about how we respond. So what I want to spend the rest of our time together today doing is talking about, how do we play with food? How do we play? How do we have fun? So remember that when you're playing with food, when you're just saying yes to mess, the idea isn't that you are teaching. The idea is not that you are eating. It's about working through those steps, working through that hierarchy in play. You should be using you can statements. So yeah, you can drive that truck through the pudding. Let me see your tracks. Oh, you can make really good chocolate tracks. Can you make a chocolate chip track on your arm? Wow, you can. And do it in relation to play, not at all in relation to what they are eating or not eating. Because again, eating isn't our focus. Play is our focus. And we should only be modeling the play, not modeling the eating, which is really hard for us because we're like, hey, look, it's so good. But our kids don't see it that way. They don't have experiences with the food as being a happy experience. So we have to build up to that. So if you eat something in front of them, they automatically are going to do one of 2 things. They're going to stop playing and make a face like, oh, that's disgusting. Why did you do that? Or they're going to just refuse to participate anymore because they think you're going to force them to eat. So let's talk about how we can play with food. This is one of my favorite things to do. Let's talk about each of the senses. Let's talk about hearing. For some of our kids, we need to start at that most basic of levels of talking about, how does food sound? So you can take crackers and put them in a plastic bag and smash them and listen to the sound of them smashing. You can take potato chips and you can crunch them underneath your hand. You can take a big scoop of yogurt and plop it onto a plate. You could put some broth in a bowl and swoosh it around. And while you're doing this, you can be talking about the food. Look at this yogurt. It looks really kind of cool and maybe a little slimy. Let's listen to it. Plop, plop. Oh, that sounded like it was definitely something that was slimy. Listen to this chip. It sounds crunchy. I wonder if it's salty. It might be salty and crunchy, and I bet it makes a loud sound. Let's listen to that again. Smash, smash, smash. After you've done this with a few foods, take the same foods and ask them to close their eyes and play a guessing game. So you can say to them, okay, I'm going to take one of our foods. Which one do you think it is? And see if they can listen to it and not only tell you what the food is, but maybe start describing it themselves. If they haven't eaten the food, they can't describe it. They don't know what they're talking about, right? So this is a great place to start. Certainly you can read books about food. That's always fun. There's lots of great videos. Sesame Street has some fantastic videos about food. And what I really love about Sesame Street too is that Cookie Monster kind of got on the bandwagon, and he talks about sometimes foods and all the time foods. And so there's a lot of healthy eating involved in that. So that's great. Sesame Street actually has an entire DVD related to just food songs that they've done. So those are some great things to do with kids too. And then talk about what you read or talk about what you watched together. All right, let's talk about sight, right? Sometimes just looking at food can really throw you off. And I'm seeing that I just scrolled down here a little bit. We do have some family members here. Hello, Shirley. Hello, Melissa, our early childhood special ed teacher. I'm so glad that you were with us along with some of our staff. And certainly if you have any questions, feel free to type them in. So sight. I love to play peekaboo games, just like we did with listening, right? So I have this bowl here, and I will put different foods in it, and then I'll pop one open. And if I have a kid who's very sensory involved and maybe will even gag at looking at foods, I will put just one piece of food in and go, okay, where is it? On your marks, get set, go. Peek. Oh, it's gone. It wasn't there. Oh, peek. Oh, there it was. You saw it. Nice job. And then I move it. Just again so that they can look at they can just look at the food and they don't have to do anything else. The food is there and then the food is gone. And certainly you can do this with bowls. You could play like they do in Vegas with the cups, right? And you put the food underneath one of the cups and you swish them around. Okay, where's the food? Ready? Look at it. Oh, there it was. Now you move it around. See if I can find the food this time. So playing visually, excuse me, with food is a great thing to do. Next is smell. Smell is huge. Smell is linked to memories, both good and bad. And I know everyone here can remember a time when they've smelled something and it brings back a memory and you're like, oh, that smells like my old grade school, or oh, that smells like grandma's perfume. Whatever that smell is that brings that emotion to your heart. Maybe it's not a good smell either, right? For some of our kids, they definitely have negative experiences related to smells. And so again, this is another one where you can play the peekaboo game and they take a quick sniff. Bags, Ziploc bags are good for this because again, it keeps the smell contained until you open it. If you can find them, what I used to love to use was film canisters that were really tiny and you could pop them open and close them again. Any sorts of jars or anything like that. I even have here a cup that is it has different gratings. So I will say, can you smell the food with the cup like this? And then I push it down a level and I'll say, okay, now can you smell the food in the cup like this? And then I'll push it down and say, now can you smell the food in the cup like this? As they keep getting closer and closer to the food. And this again is just a cute little thing that I found like at the dollar store or something somewhere. So lots of really inexpensive things that you can do with things around your home. Of course, the most important thing that you can do with kids is cooking together, right? So involving them in the cooking process. And maybe it's not safe to have them near the stove, or maybe it's not safe to have them doing the cutting or the stirring. But even if they're sitting there with you and you're talking about what you're doing, do you smell that? Do you smell mom frying the onions? I'm going to add the ground beef. Listen to the sizzle. Do you smell that? Oh, wow, that smells really yummy. I think it feels a little bit like there's lots of pieces in my mouth when I take a taste, I wonder what this would be like compared to this tomato, which is kind of smooth and a little bit sweet. And again, you're talking about it, you're smelling it, you're explaining what you're doing. Um, Touch is a huge piece for our kids. A lot of our children have significant difficulty with just touching foods. So this is where we're going to get really messy. So I am a huge fan of garbage bags. You open up the garbage bag, you cut it out open on 3 sides, you spread it underneath the area that you're working on. I'm a big fan of old junky towels spread on the floor, right? I'm a big fan of your junk. This is my junk. Cookie sheet, this is great. For our kids who may really get messy, I might use a deeper bin so that if I'm a mom with new carpeting in my house, or maybe I'm not that good with mess, I'm keeping the mess contained in something like this. So lots of ideas for things that you have in the house. I've had parents who do this in the bathtub. I've had parents who do this in the kitchen sink. I've had lots of families do this outside. I promise you it will get warm this time of year. Eventually, we will get there. And you can do this out on the patio or out on the sidewalk or out on the lawn. A big thing about touching food, though, is that you have to allow kids to be able to wipe, okay? So they've touched the food, and now they're like, ugh, what do I do? So I always have an extra towel or something that they can wipe their hands on. They've experienced it. Now they give themselves some of their own sensory information to say, okay, I'm re-regulating myself, and now I'm ready to touch again. There's lots of kids who, again, they can't touch it right away. So we use something to help them touch it, right? I'm a big fan of fun forks. You know, this one's a fire truck. Woo! And I poke the food with that. So again, they're still interacting with the food, but they've got something between them. And so I might start with the kid and saying, can you hold the fork on the end of the fire truck? Now can you hold the fire truck? Can you go on the bottom of the fire truck? Yeah, go way down there. Okay, now poke it. And I keep getting them closer to the food as we move. I'm a big fan of mittens on hands because some of that is going to soak through the mittens, or any of these washcloth puppets that people like to use. This is a great one too for touching foods. And then you can do some pretend play too. And it always happens, another hand gets in there and you're like, oh wow, you can touch the food with your hand and you can touch the food with your puppet. What a great job. And then if they need to wipe, it's right here for them. So that's super fun. Animals in the mud, right? I play with chocolate pudding way more than I should probably. So if you're looking for stock option, chocolate pudding. And go ahead and put those animals in the mud, and get little animals too, because you know what? The smaller the piece, the more chocolate's going to get on their hand, and then they have to put the baby animal in with the mama animal, and oh, you got chocolate too. You got mud on your hands too. So that's a really fun thing to do. Taking cars, driving them in the mud, making tracks, anything like that works. Just make sure that they're part of the cleanup process too, right? So washing the food off of those materials, they're still touching the food. So get a big bin full of soapy water or a big kitchen sink full of soapy water. Okay, help me clean this up. And that's a great trick for kids who really are starting to collapse, who are starting to say, okay, I'm done with this, I've had too much. Then you say, you know what, you're right, let's clean up together. And sometimes just that emotional, mental piece of I'm done is enough to get them over the hump and re-engage with touching the food. So, okay, help me take everything to the sink. Let's wash it up together. So those are some ideas for touch. Now, eventually we might get to taste, and that would be really exciting, right? But this has to be something that is child-led. And again, you have to allow them, if they take a taste, to spit something out. So I may, again, have a bowl or a cup and say, this is your spitting cup. This is where our tastes that we don't want go, but they only go in here. They do not go anywhere else. And we might practice spitting. You got to learn to get the food out before you let the food go down. I practice a lot of spitting with my kids. It's a great technique for those, again, who maybe don't even have the oral motor skills, and it might not be safe for them to be swallowing. So I'm a real big fan of teaching kids how to spit, and again, wiping in designated areas or on designated cloths. So following the child, you can go ahead and try to get some tastes. It might just be a kiss to the lips or to the teeth. I'm a big fan of these types of little guys because they have itty bitty, teeny tiny little beaks here, or whoever or whatever kind of animal it is, and you can dip it in the food and go, okay, he's going to give you a taste too. Mama birdie's feeding you. You're the baby birdie. Mwah, mwah, mwah. And then you get a tiny taste, because to these kids, size makes a huge difference, right? So we're not going to take a spoonful of food and shove it in their mouth. They're going to start by taking little tiny tastes. I take sugar crystals, salt, individual salt, and I'll say, can we just take one? And they'll pull it out, and they do one, and it dissolves before they can even spit it out. And then they got to practice swallowing too, which is always very exciting. So thinking about the size when we get to taste. Veggie straws. Okay, can we just be honest? Veggie straws are not healthy. But veggie straws are really cool because they look like a horn. And so you can put them in your lips, and then I will put them up to my lips and say, let's make a musical band. And then I'll go, guess what? No hand band. And before you know it, that kid is holding the veggie straw in their lips, in their teeth, because it's starting to dissolve. And they're like, oh no, it's falling out, it's falling out. I still want to be part of the no hand band. And so they push it farther in their mouth, and you got the veggie straw in their mouth. So thinking about how you can do things even with regular straws. Could you take a straw and dip it in some flavored water just to get some taste? Again, all of this should really be child-led. So I have talked, as you can tell, about something that I'm very passionate about. Love working with this population, and probably could talk all day, but I know that Jessica, our public relations person, is on here, and she's going to make me cut it off. So I'm going to do it to myself and open it up for any questions that anybody may have here. If they want to type any questions here on the side, I am looking. And if not, I appreciate all the hearts and the smiles and the emojis. I'm feeling your love, guys. I love it that we're all interacting. So I'm going to give it another minute here. Okay, somebody says they have tons of empty prescription bottles. That's nice, Chrissy. Thank you. That's a great idea. Yeah, just get rid of those labels and use those. Those are great too if you put essential oils in them, or I'm not thinking of essential oils. I'm thinking of extracts like vanilla extract or lemon extract in there, and then you can say, what does this smell like? Extracts are good for that. So I'm not seeing any questions here, but I really appreciated that you all joined us today. Please know that this is a population that many of our therapists love to work with. It's not just me. So we have an entire team of professionals ready to serve you here. The great thing about us right now, especially in this time of such uncertainty, is that we are open and we are here for you. We are doing phenomenal with telehealth. So if you are feeling like right now is not the time to venture out into the world with your little one, we respect that. We understand that, and we're here like this for you. So if virtual is what works for you, let us know. Give us a call. Look up our number. We have 3 fantastic clinics that are ready to serve you. Oak Creek, and I forgot the names of the locations of our clinics, which is bad, right? Oak Creek, Racine, and Kenosha. And we are more than happy to get started with you, or just to problem solve with you, or answer any questions you might have. So wishing you continued health and wellness. Thank you so much for joining us today on our Friday Fun Facts. And happy Better Speech and Hearing Month, everybody. All right. You guys continue to take care. Oh, wait, we have one question. I teach early childhood special education for 3-year-olds. What are some more activities for getting kids to chew, not store in the cheeks? I think that's because they're not chewing with the back teeth. Okay, so there's a couple things to this, Melissa. So first of all, chewing is a skill. So they may not have the skill to chew, which may be why they are chewing it, or why they are storing it in their cheeks. They might be sucking on it. If you see kids chewing like this, they're chewing it right here in the front. That's a very immature pattern. If you see this, that's tongue to palate mashing. They might just be using their tongue and the top of their mouth to soften that food. They're both very immature and atypical patterns for our kids. And so what happens if you try to do that at home, you will see the food does not get masticated or ground up as much as it should. And so they don't feel safe swallowing it. So they will store it in their cheeks. So firstly, it could be skill. Secondly, kids who store food in their cheeks maybe doing so from a swallowing standpoint, it might be that they aren't feeling safe swallowing, which is why it's so great as you, a special ed teacher, here listening to me, a speech therapist. We're team members, right? We're like this. So maybe there's an actual swallowing, maybe there's an actual dysphagia issue that we should just rule out just to make sure. The third issue is lots of little ones, especially in the special ed population. They may have some of those sensory problems that we talked about. And these kids are really, really good at, for lack of a better word, sucking the juice out of everything, right? They suck and they suck and they suck and they get that flavor and then they just put it over here. They're like, well, I'm done with that. I got all the flavor out of it. Some of those kids don't even realize that food is still there. So I would say that my recommendation to you is to work with the speech pathologist in your school. I know that not all school-based speech pathologists are comfortable working on feeding and swallowing. So certainly there may be other resources for you out there. But again, looking at what are the skills of these kids and why are they doing this? Because getting kids to chew is really, really important for safety. So did I kind of answer your question, Melissa? This is the weird part about virtual interaction, waiting for the response. And as a speech therapist, it's a little hard pragmatically. So hopefully I helped Melissa. Melissa, you can give us a call. Hey, maybe we can set up some sort of consultation with your school district or something, right? Thinking outside the box. A couple of my bosses are on here. Maybe we can do that. All right, anybody else have any other questions? No. Okay, well, again, and I'm scrolling down, I'm just looking. Oh, Melissa wants to know, oh, Melissa, you've got so many great things. Okay, she asked the parents to tune in. If that's the case, also scraping just the tops. She thinks that that's the top. Okay, she thinks that that's it, is that they're just scraping at the tops of the food. Any summer programs? Melissa, you've asked a great question. By 6 o'clock today, we are all turning in our summer program ideas. I and one of my OT colleagues are running a food school. We have food school probably going on at all 3 of our locations, which is fantastic. We, again, we have sensory-based programming that will be going on this summer. We have tons of programming related specifically to speech sounds and motor, gross motor, fine motor, and we will be getting that all up as soon as we are done planning. The other thing that we're really looking at is, can we do anything virtually, and can we just keep the kids outside to keep them socially distanced and safe? So Melissa, to answer your question, yes. Yes, we are offering summer programming, and that is coming. And if you would like to give us your information, you may, we'd be happy to email that to you. Meg wants to know, hey Meg Marie, welcome. Can you implement feeding therapy via teletherapy? You can. I've actually been doing a lot of feeding therapy via teletherapy, and it certainly has been a shift for a lot of us. But what's really great actually about doing it via teletherapy is that it really gets the parents involved. And so this really helps us as therapists to coach the families and to help the families to feel more successful with feeding therapy. Hey, we might be the best clinician in the world, but if we are only with that child for 30 minutes, maybe once or twice a week, it doesn't make a difference. It's what's happening at home. So doing feeding via teletherapy is fantastic. Yes, we absolutely can do it. And we've been doing it very successfully, and we're continuing to learn how to do it. So absolutely, if you are a parent who's interested in feeding via teletherapy, give us a call. If you are you know, just asking again, is that something that you could refer somebody to? Yes, we are doing that. It is billable, it is ethical, and we have found it to be very successful for some of our families. These are great questions. Love the interaction. Okay. Just scrolling through here again. Waiting to see if there's anything else. Thanks, guys, for all the love. All right. So I'm going to do this for Meg and Melissa. I'm going to type in my email address. therapyllc.com, and you can feel free to reach out to me personally, and I will make sure to get you to the right person. Okay? So there I am, and you can feel free. Emily Jane, share that summer info with me, and I will refer families. Oh, Emily treats her daughter. Very cool. Emily's great. Emily's great. So there's my email address. If anybody wants to contact me, I will certainly get you to the right people. Just waiting here to see if there's anything else, Melissa. Perfect. Good. All right. Well, this has been really fun. We're going to have more of these every Friday. We've got lots of fun things to talk about. So be sure to join us. Be sure to tune in. Be sure to keep an eye on our Facebook page. We're sharing lots of things all the time, every day. And again, just wishing you all continued health and wellness. This is being taped, so certainly you can go back and look at it later and spread the word. We just want to share the information, right? Everybody's looking for information, especially now with being at home. Some families are really trying to implement things on their own, which again is very exciting. And I think some families are feeling a little disconnected from maybe their providers, and they're looking for some support, and that's why we're here. So anything else we can do for you, give us a call, let us know. Otherwise, I'm going to sign off and wish you all a wonderful, wonderful snowy weekend. All right. Have a great day, everybody. Bye-bye.